Welcome to the Littleton Board of Health Wednesday, August 25th, 2021 virtual Zoom meeting. We're starting a little early tonight because we, prior to today, I thought we had a lot of school stuff to talk about, but I think the commissioners kind of beat us to the punch. But we're starting at 6 o'clock with a public hearing regarding COVID-19 update and mitigation strategies. So Jim, did you want to start with that at all?
I sent Mike some numbers earlier, the 2-week numbers, so that he could, I assume, pass them on to Katrina. The cases have continued to go up from week to week as those 2-week rolling numbers come in from the state. Mike asked for some additional information, kind of some historical information for the summer, the number of cases for June, July, and August. So through the month of June, it looked like there were 3 cases in Littleton. If I go by what we came in and what I was able to pull down from the state's raw data. From July, for the month of July, it looked like there were 5 cases. And again, this is kind of going back and forth with what we got reported and the raw data from the state. The last reporting time frame, which is the last from August 1st to the 14th, that's the number from last week. The new number comes out tomorrow. There were 14 cases in those 2 weeks. We know just looking at Maven this morning, this number that's coming out tomorrow, that 2-week number goes up to probably 17. I'm not sure how it will actually fall out. That's kind of the quick peek I can take a look at in Maven. And based on some of the cases that we've had the end of last week and this week, the subsequent weeks will probably be higher also. So we are seeing cases increase. And I guess what I would say about the increases, one of the things I've noticed is multiple cases at the same address. So that's the kind of stuff we're seeing. Lisa talked a little bit about the commissioner's letter. I saw that come in late today, mandating masks in schools until October 1st. So I think that that piece of it is, I don't know if that helps school departments, if that helps towns. I think it makes sense for the beginning of the school year, particularly. Hopefully we'll see how this surge in cases kind of shakes out. So that's all I have for you, Lisa.
Any idea, Jim, about the 17 cases, were they vaccinated or not? Or is that?
There's not a lot of that data that comes into the system. I thought it was pulling it automatically from the state's database, but it doesn't appear to be. So when they ask, when they're doing the contact tracing, they ask, and if that information is given, then it's put in the record. So I think we're probably getting, I don't know, 5 to 10% of the people kind of disclosing vaccine, whether they've been vaccinated or not. And it's probably a mix of, I don't want to say half and half because I haven't really looked at the numbers that closely, but it's a mix. There's certainly the vaccinated are certainly represented amongst the cases we're seeing.
Go ahead, Mike.
Yeah, Jim, when you supplied what we'll call the early Maven or initial Maven estimates, we'll call them, I also noted that the towns around us were also seeing an increase. I was rather struck by Harvard. I believe it's one of them, and I believe Pepperell. I'm not quite sure, but I remember I started matching up those rate changes to what happened just to make sure that we don't repeat the same mistakes that were made earlier in the year when we thought things were just fine. And it turns out it's almost a match.
Yep.
We're following the same path. The urgency is there. It's there.
I think when I look back at the numbers that I have been giving you, the last time they were that high, I think was in April.
Yep.
April 2021? April?
This past April, yeah. So one other point about the some of the higher numbers, I think Town of Shirley is one of the numbers that's on there. A lot of that is the prison. So those numbers come into Shirley. I think we had an event in north of up in New Hampshire that I think affected Pepperell's numbers. So, and the rest of them I don't really know there's nothing I can really point to and say, geez, that's what it was. So, but those two things, if you're looking at those numbers and why they're high in those two towns, there are reasons for those.
Oh, thanks, Jim. I wasn't asking you to,
Yep.
The mechanism is known. It's called viral spread.
Yep. Right.
Yeah.
All right. Any of the Board of Health have any questions at all for Jim? Dan, Gino?
Thank you for what you're doing, Jimmy. Lisa, next time you send me an email, would you be kind enough to send me the ID number? I had to call Kevin, your email, I didn't have your number, and also I didn't have any number, password or anything.
It's on the town website, Gino. It's on the town website under our agenda. So you can just get on the town website and click on. So, all right. Does anybody, go ahead, Dan.
Sorry, quick question for Jim. I saw last week's numbers. I can't remember. What was our percent positivity? It was about 2%. Is that?
I think I'm sorry, I don't have those numbers right at my fingertips. I think it might have either 2 weeks ago was like 1.94, and I think this week it might have been up a little bit higher this past week. It was still under the state's number, as I recall, but was up from the previous week.
And how the public health nurses maybe do with contact tracing? You're saying they weren't getting necessarily all the information they needed regarding vaccination status. I'm curious how is contact tracing gone since we've bumped from less than 5 reportable 3 reporting periods ago. Now we're at 14 officially and looks like 17 tomorrow. How they were with contact tracing and frequency of close contacts.
So again, we have 3 public health nurses working for the district. Yesterday, 35 cases came in throughout the district. Today, 22 cases came in through the district. So a lot of cases are being referred to CTC. And so both us and CTC are doing the contact tracing. And so when they do that contact tracing, one of the questions they ask, if people will pick up the phone, if people will cooperate with the contact tracing, is their vaccination status.
Can I just add about the agenda tonight, everybody, that we're meeting early to do this discussion, but we do have public hearings at 7. And after the public hearings, we can come back to this if we need more time. So sorry to interrupt you. All right. Anybody else have questions for Jim?
Thank you, Jim, for what you're doing.
You're welcome, Gino.
Lisa,
Yes, Mike.
I just have a question. Could Cindy or Chuck or Matthew indicate whether or not they're within the open meeting rules, since I see that, have you called formally a meeting of the select board for tonight? Wonderful. Good.
Yeah, good.
Great. Thanks.
Okay. Dan, you had something else you wanted to ask?
That's a quick question. I don't see Alicia here. I have heard rumors, I have not seen anything official through Board of Health channels, that Camp T or some portion of Parks and Rec camp programs was shut down this week. I've not seen anything officially come through channels. Is there anything either the chair or Jim, as our public health agent, can share with what the status is of Parks and Rec Camp T?
Yeah. It's Explorers, right, Jim?
Yes, TX, I guess is the name of the program.
TX. Yeah.
Yep.
So they had an exposure.
So they had a case at camp, and they decided, and we've done some contact tracing. I did that on Saturday for the first round of kids, and they had a second one that Alicia called me about. And then I think it was at that point they decided to close both that and the playground programs down.
Did that answer your question, Dan?
I guess I'm curious of, certainly, we talked about closing the beach as a preventative measure for algae at our last meeting, and we certainly asked that, certainly a high visibility public health response, public health, reaction or interaction regarding something was shared with the board. Certainly, I think shutting down Camp T in our little town certainly raises some flags for many people and is certainly a high visibility action. I was certainly disappointed that the board as a group was not notified of that action, and certainly I'm not sure if anyone else got it. I got a number of phone calls having kids in schools that hey, what's going on with Camp T? And while certainly personally that's a bit embarrassing, it's also disappointing from a Board of Health perspective that members were not notified, and even up until just I asked, have not been notified of a high visibility public health action. Now, that may have been Parks and Rec choice. It sounds like it was in conjunction or in consultation with Jim that this really shouldn't happen 2 weeks after our last request, that these kind of things don't happen without Board of Health being aware.
Any comments at all? All right, so we've got the COVID update. So now mitigation strategies. Mike or Dan, did you guys want to start with this?
I don't think we have an order of marching. Dan, would you like to weigh in?
I'm certainly happy to start. The challenge in any public health, certainly in communicable disease piece, is that when public health works, it's invisible. You know, we do things and nothing happens and everyone goes along, you know, nice and happy. It's when we don't act, identify, intervene, and bad things happen that the world looks at us and go, why didn't you? It's a hard balancing act for any injury prevention, communicable disease prevention program of how do you find that balance. I'm certainly looking at where we are, again, from 3 reporting periods ago when we were an asterisk because we were less than 5 reportable cases to potentially 17 on the state tomorrow, still significantly lower than we have been at some points in the past 18 months. But certainly a concerning trend that within, you know, basically a month or month and a half of reporting, we've gone from an unreportable number to 17 in our little town of 10,000. I'm certainly happy that we are starting to get some clearer guidance from PH and from DESE, and certainly from the CDC. The guidance has been very, very clear now for the last few weeks. I would love to hear discussion. I see Katrina on. She shared some numbers with us. It looks like it was from the previous reporting period as opposed to this week. If she has any more input, again, we've got a world-class epidemiologist at our fingertips, any pieces of where we are, what the trends are showing, and then we can decide what actions we may want to take or not take. But I would love to hear some hard numbers and predictions from an expert if we can.
Mike, do you want to say anything before we bring Katrina on, or?
Oh, I think it's a great place to at least start because we have a lot of work ahead of us. Let's put it that way.
Katrina, are you ready? Do you mind?
I was told I didn't have to prepare anything, so I'll wing it.
I'm sure you can do it.
So I guess let me answer the questions you guys have, because what Dan just said is completely correct. When we look at the state data for our town alone, we have had a week over week increase for the last 6 periods, 2-week period, reporting periods. So, and while they're not necessarily doubling events, which is reassuring that we're not just exploding, they're still concerning that we are now at a level that it's yellow based on that old coloring scale that the DPH no longer reports on their weekly data from their old way. And then if you look at it, if you calculate the last, that 17, I mean, Middlesex County and Worcester County are both in the red when you use the CDC metric. So we're in a hot zone right now of transmission that's happening. And that is a level that we haven't seen since just before Halloween last year. So it's concerning. If you have specific questions, I'll try to answer them and see what I have at my fingertips for. Oh, and the other thing I think is important as I'm saying this out loud, is that it's every single age group's increasing across the state. The rates for each age group keeps growing together. So there's no one age group that sticks out that you could mitigate or try to target. This is a community-wide, all age groups, all in it together kind of situation.
Wondering, Katrina, if you could dig back down and say, what was the were the most number of cases, positive cases that we had in town, and when was it? Probably like December-ish, right?
It was December or early January. Let me pull up my data. My tracking form.
I think I might have asked you this on Monday too.
So I just closed it on myself. See, this is what happens when I'm not prepared, guys. Okay, so we had the most cases in a 2-week period. That is the January 9th report. So those would have been the 2 weeks, the last 2 weeks. Last week of December, first week of January, that time period.
And how many was that?
It was, now you're asking the tough questions. I'm in the wrong spot. Let me get there. I've gone all the way back a year. This is sad. Okay, so the January 14th report, we had 69 cases. That 2-week period.
All right. Go ahead, Mike.
Yeah, I took some of the same data that Katrina just mentioned and just did a little, what we'll call it, a delta, a change in rate to try to understand where we're drifting to, because absolute numbers have fooled us before. And this is one of the reasons why we're meeting tonight, is to discuss, not necessarily tonight and make a determination of what action we should take, but what mitigation options are really open to us and what we should consider more formally at the next meeting of our board, which I hope happens soon. If you hear a sense of urgency in my voice, you've got it correct, mainly because I know a little bit about the variant that's out there now, and the variants, if you pardon the expression, are waiting in the wings, and I'd rather not see any of them, frankly, and I'm don't find this particularly comforting. On the other hand, I think it's important to understand what we can do. The vaccine is very, very effective. And I don't expect to see the kind, at least I hope we don't see the kind of numbers that we saw a year ago or during that December period. I also don't think we're going to, I hope we don't see this lasting to a period of time that I hope we move to, which is what I would call the maintenance period. That is when this virus, the disease that is associated with it, becomes what they say endemic. That is, it's part of our life, along with the vaccine regimes and whatever have you. And the longer we wait to, as it were, suppress further rises, further spread, not just in this town, but in the state and in general, the easier that maintenance period, which is really very concerning, would come. So this is why anything we do, if we do it quick enough to do everything we can, not everything's going to be successful, everything we can to suppress the community spread will protect immediately protect our schools. In other words, they have a lot of stuff already embedded. So anything that we do for the town is a major contributor, because we know from past experience that community spread, that is what goes on outside the school, creeps into the school. So the idea here is, what can we do? There's a question, no proposals yet for solutions. What can we do to, as it were, do what we can, along with the vaccine, which is very powerful, to suppress, so that we can limit as much as possible that community spread, not just for the immediate, but for the longer term, for the benefit of the longer term. Let's put it that way. So I'm hoping that after we do the review of what Katrina and Jim, and maybe there are others sitting here with data that we don't have access to, it would be worthwhile to just briefly consider, in my view, what our options really are, because the vaccine, as far as I know, there's only one drug, and I wouldn't call it a drug. It's the Regeneron product. There's a vaccine and a product. And that's about it, along with what we'll call more physical interventions. And so that's all. I just think we ought to move to that, not necessarily take any votes tonight, but also consider how best to the best way for us to proceed at the next meeting to recommend or to mandate. I don't know what words we're going to use, but certainly to as it were, catch it before the delta gets larger.
All right, so do we want to start some discussion on some mitigation strategies? I know there's the big M word that is, or advisory, or the M word that is the elephant in the room, I think. So anybody want to start with that? Go ahead, Kevin.
I just think the Vax bus coming to town is such a great thing that we have at our fingertips. I wanted to thank Anthony for arranging that.
Hear, hear.
That's the number one mitigation strategy we can take.
Yeah, and I don't know about you guys, but I got a reverse robo. You got the robocall, the reverse 911. That's Anthony. So thank you again, Anthony. I said that before we went live, but yeah, that's great.
I can speak to the mask word if you'd like. I mean,
the M word.
I'm not sure why we are debating a tool that is probably going to help us. Mandating, for example, masks indoors. We just heard that the curve is looking at identical to the curve that we had before the first peak. And we know from Katrina's excellent presentations that this is a multi-layered strategy. Vaccine is important, mask is important, social distancing is important. Why are we hesitant to ask people to wear masks if they're indoors in public places in Littleton? And I think we should. That's my opinion.
I agree. I think it's the next best strategy to mitigate this thing.
It's true.
I'll jump in and offer a counter argument to that. I think that the state has appreciate all that everybody does, and Katrina certainly yeoman's work, and can't thank you enough for all you do and for all of you. But the state has a lot of resources at their disposal as well, and they're looking at cities and towns that are in a lot worse shape. And there's no mask mandate coming down from the state level. So for us to take away folks' liberties and not allow people to make individual responsible decisions, and mandating that restaurants and public places have indoor mask mandates. That being said, I choose to wear a mask. I just came back from Donlands and I wore my mask at Donlands. So, I mean, it's, I don't think we're at the point now where we should be mandating it. I think that we should follow whatever the state's guidance is.
Point taken. I think Dan had his hand up first, Mike.
Agreed.
All right, two things. One, through the chair to Chuck, that certainly I understand the individual freedom argument. I would put it out there, however, that certainly in public health emergencies, which the governor today reinforced the state of emergency regarding COVID, that, taking relatively innocuous actions to minimize potential devastation is standard public health practice. Certainly, we all give up some levels of personal freedoms to be part of our society. We stop at red lights. It's a distraction. It's an interruption. I would prefer, you can laugh, but this is the exact same piece, is that a relatively minor inconvenience of wearing a mask to decrease the spread of a potentially deadly virus is a relatively minor inconvenience for a potential enormous good. That you can say the state has not come out with a mandate. Multiple communities have, who look both higher infection risks as well as lower infection risks than us. And the CDC has been very, very clear that for counties with high rates of transmission, which Middlesex County is, their recommendation is you will wear masks everywhere, universal, every public space. It is very clear. The CDC cannot put out a mandate, but the CDC messaging is incredibly clear and obvious that simply using a public, an independence piece, that goes against every piece of public health practice, goes back to 1900 with FDA and meds and temperature of food. We do inspections in restaurants every single day to make sure that we are following public health practice, best practice to avoid infectious and food-based illness. We do this every single day. So the mask mandate, I don't think is so onerous to bring up a liberties argument from my perspective as a clinician. I'll use the example of as a nurse. If you're having open heart surgery and I walk in and I decide in the OR, I choose not to wear a mask, I'm guessing you're probably not going to be happy about me standing over your family members openly.
I don't see the parallel, but I respectfully disagree with you, Dan. That's all.
Cindy, 1 second. Mike was.
Well, let Cindy, please.
Okay, go ahead,
We
Cindy.
need all the input we can get.
Okay.
Cindy, please.
Go
Yeah,
ahead.
thank you. Thanks, Mike. Thank you, Lisa, through the chair. With respect to the numbers that were cited earlier, how many of the positive cases in Littleton are attributed to the Life Care Center? Do we know? Because last time when we were tracking numbers, we were able to differentiate how many of those cases, those positive cases were specifically attributed to the Life Care Center compared to the community at large.
So Lisa, if I may answer that.
Yeah, definitely, Jim.
So at this point here, through the 14th of August, none of those cases are
None.
attributed to the Life Care. Yeah, so that address isn't showing up. when we
Okay.
get that information.
Okay. And then Katrina had cited, Lisa, that was a great question asking about the highest peak that we experienced last year, which was December and into early January. And I remember during one of her presentations, she had talked about the college kids coming home, the holidays, people getting together, and then that curve, which resulted in that spike of cases in the town of Littleton. So I just wanted to put some context into those numbers. And the other question I had, do we have any idea how many residents in Littleton currently are not vaccinated or are vaccinated?
Quite a few.
We have 73% are fully vaccinated. If
Okay,
you give me a minute, I'll pull up the other numbers.
okay,
So 73% of our entire population, and it is important to use our entire population because kids are part of our population
mhm,
at risk. So 73% are fully vaccinated, 6% are partially vaccinated, and there remain just over 800 individuals who are eligible but not vaccinated. So that does not, there's 13% who are less than 12 who are not eligible. So there's still 9% of our population who is not vaccinated yet,
okay,
who could be.
thank you. And then with respect to the mask mandate, I was just curious how that would be enforced. Littleton is a transient community. We have people coming from all over to patronize the Point, Market Basket, other local establishments. How would we enforce a mask mandate in Littleton specifically? And what impact do we feel that that's going to have on our community as a whole? And I don't want to say this, but I'm going to say it from an economic standpoint. If you're going to go to dinner, are you going to go to a dinner in a town that you need to wear a mask? Are you going to go food shopping at Market Basket? Or are you going to go to Littleton Market Basket? Or are you going to go elsewhere? I just want us to really take into consideration the whole picture when we talk about a mask mandate. I personally am not in favor of it. And I'm not speaking on behalf of the select board. I'm just speaking as myself individually. I just don't, I think it will be very difficult to enforce it. And I just don't, I think that we should leave it up to the discretion of the individual, whether they want to wear a mask or not. Thank you.
Go ahead, Mike.
Yeah, I'm not trying to get into an argument because we're having the same arguments or discussions and points raised earlier. First of all, there's no evidence whatsoever that I can find, as a matter of fact, at least in the United States, that masking, mandated masking has a large impact on economic activity of the type, what we'll call consumer related. And in this town, I'd like to point out there's some major public, shall we say, very visible public businesses. And I'm talking about CVS, and I don't mean to pick on them. CVS has posted right in the front of their store, masks are required. There is nothing, as has been pointed out to me, the town is not backing them up. Number
I thought
one.
it said recommended.
No, it says required. Okay, and then given it's a healthcare facility, they provide services, including shots. We should back them up, whether it's required or recommended in this CVS. Secondly, all CVS employees, starting almost immediately, are going to have to be vaccinated. So therefore, bringing or not having at least what we'll call a thin layer of protection for our town makes it that much more difficult for CVS and also Market Basket. Market Basket employees are required to wear a mask. However, if you go in there, you will discover that a lot of patrons, many of them, sometimes most of them, are not wearing masks, putting those employees at risk, and vice versa. If masking is required, and knowing the town of Littleton, where, as far as I can make out, masking when it was mandated was pretty well followed by the majority of the town.
Right.
Because at the time we did not have vaccines, excuse me. So I think what we're doing is we're having the same discussion with the same topics that we had a year ago. And we've learned our lesson. And I'm not interested in engaging personally in the debate about whether or not masking is, shall we say, an effective tool. The question is, what's the best way to provide protection for our residents, given where we are? And I just mean both geographically and with respect to the disease. We are not in isolation. The very reason that you gave, Cindy, is we got lots of people passing through town with and without masks, with and without vaccination. Let's give our town residents, at least who are here, some degree of protection, whether they're vaccinated or not. Let's encourage what Littleton has already done. Doesn't take much for the people of this town to do the right thing. A mandate makes it very clear. Not only does the Board of Health take it seriously, but I'm hoping that the Select Board also joins us in supporting it. Supporting the idea of protecting the residents of our town with what we have at our disposal, which isn't, if you think about it, beyond vaccines, is masking. We can talk about distancing, washing our hands. Let's not drop something from our, shall we say, our repertoire at this point. We can put timelines on it and make enforcement as soft as we want. I'm sorry.
Can I
Thanks.
ask a question now? Thanks, Mike. Sorry. I didn't mean to interrupt you.
It's okay. Sorry.
Go ahead and interrupt you. So would a mask mandate require outdoors too? If you were out for a walk, if you were out hiking, if the kids are out playing basketball, if they're at Long Lake, are they going to have to wear masks, or is it just indoors?
Indoors, right?
Indoor, as far as, I'm sorry, to the chair, indoors is a good place for us. We can do something indoors. That is a big chop right into it.
I think the other thing, Cindy, is we're talking about masks. We're not talking about those 6 feet of distance, in the restaurants that we had to do before.
Okay.
So I don't think at this point we're talking about, limiting how many people they can have in their restaurants either. Just wear a mask when you walk in and when you're not eating or sitting. So.
Okay. And so say as far as town hall goes, say there was a mask mandate for, I'm going to use Shattuck Street Town Hall as an example. For the employees, would they have to wear a mask all the time, even if they're in their office? What would that look like?
I think it's a matter of square footage and how many people are in it. And by the way, I consider the town hall to be your bailiwick. I mean, it's where the government is. There are methods. There is an easy method, a monitor that you can use to quickly determine when any of these rooms, shall we say, get too stuffy, too many people in them. It's pretty straightforward. Again, I'm not looking for, I think if we could get your help in composing the, shall we say, the regulation, make it indoors, put some parameters on it, make the, shall we say, the compliance, not so much the compliance, but the failure to comply as soft as possible. I'm more interested in taking advantage of the people in Littleton themselves who, once they see a mandate, they take it seriously, they'll plot it.
Okay, thank you.
I know, Chuck, do you still have a question?
Yeah, I do. Yeah, I didn't know if I was muted or not. So first of all, Mike, I don't disagree with anything that you said. And, this is all discussion, and I'm not looking to get into arguments or anything like that. But the fact that CVS is taking that action it was their choice, and I support that choice. And any other business that chooses to impose those mandates of their own within their own business, and I support those businesses. So, but to imply that the select board, if we choose not to do a mandate for whatever reason, to imply that we're not looking out for the public safety or to protect our residents is disingenuous, and I don't appreciate it, Mike. Every decision that we make is based upon data, information, and doing what we feel is the highest and best for our citizenry.
I'm sorry, Mike. Katrina has her hand up, and
Please.
Matthew had his up too.
If I may, through the chair. Cindy, to answer your question about the economic impact of that, I have a different perspective. I might be one of the few people on this panel tonight who has kids who are not eligible to be vaccinated yet. So we're living in this world of like parents vaccinated, my eldest is vaccinated, and I have an unvaccinated kid. And I actually frequent businesses who are using mitigation when I bring him along. And so for me to have at least a sign on the door that masks are encouraged, used, and you walk in the building and you see that the employees are wearing masks and there's people taking care, that makes me feel better about bringing my child into those businesses and to patronize it, like spending my money there. So being a patron of those businesses. And so to me, that's also builds to this bigger, broader community caring perspective, which I know Littleton does very well in many things, and that I would love to see taking, we used that when we did the Mask Up 01460. That was kind of that component of it, like, let's take care of each other and wear a mask back in November. And then that's where the rates are right now, right when now is when we were talking about it then. And then we adopted as a town using the CDC's recommendations for masks for public buildings in May, when the CDC said vaccinated people could choose to wear them or not, and unvaccinated people were recommended to, but it wasn't required. So like we've all along kind of followed either the state mandate or the CDC guidance for masking. And so to me, as a person who's walking in with someone who is at a risk of exposure, which would then potentially disrupt his education for yet a third year out of his 5 that he's been in public school here in Littleton. To me, that's just a step that I'm not even talking mandate or required, but like just that is a sign that we're taking care and we're being consistent with our messaging about that.
Great point, Katrina. Thank you.
Katrina. Matthew, did you have a question or a comment?
I just wanted to speak to the enforcement briefly. I think, I don't think any of us are expecting the Littleton Police Department to go around issuing tickets. This is an encouragement. It represents the town's commitment to keeping the residents safe. It shows that we're serious about it. I believe it will, as Mr. Zeldin indicated, encourage people to wear masks. I don't think that anyone's going to get in trouble for not doing it. It also gives businesses who want to enforce it the right to insist that their patrons wear masks and to enforce that policy by pointing out that the town does. And I simply, for the life of me, cannot understand the personal freedoms argument. As Mr. Kane said, we all give up personal freedoms all the time. This is not a civil liberty like you being arrested and tortured by the secret police. This is putting a piece of cloth over your face. It's not the same at all. And I wish that people would understand that it's not equivalent to your rights. It's a mitigation strategy to help protect your fellow citizens. Thank you.
Thanks. And I think also in terms of enforcement, during the last mask mandate, Jim was very active in answering reporting to, when we had reports of people not wearing masks, he was very right on it going into those businesses. And then there was one wedding or something that LPD actually did show up, but I think they were there a little too late. So it was reported to the dispatcher, and the dispatcher said Board of Health takes care of it, but we don't want Jim going to a public resident, to enforce masks. So that would be dangerous, and it's just not his place. So go ahead, Kevin.
I'd just like to add, we did make Chief Bernard an agent of the Board of Health, just in case he had to do anything.
Yeah.
And I feel like, just to piggyback on what's being said here, if we can get the notices on the buildings and have the people inside do the right thing, that will be in much better shape for it down the road and help stop the spread of this virus.
Okay. And Mike, did you have one more comment to do?
No, I'm sorry that Chuck took my remarks as somehow attributing it to the Board of Selectmen. I don't think you had a chance yet to meet and to decide whether to what extent you'd like to contribute and join in. There is no expectation, by the way, it would be very, very helpful for the town and for us for any number of reasons, for at least not at the least, but for both the Board of Health and the Select Board to both, without any question, reflecting the fact that we want the best and we're trying to give protection to the residents and the folks who pass through Littleton. If you decide otherwise, that's a different, how you want to interpret that is open. I'm looking at the positive effect of joining in and assisting in protecting the people of Littleton.
I'm not sure exactly what we do next. We take public, Anthony, do you have anything to say about this? And then do we take public comments at all? I know we've got 15 minutes before we get to our regularly scheduled public hearing for variances.
Thanks, Lisa. Just to update folks, we do have a working group, a COVID working group that we put together that includes myself, Chairman of the Board of Select Board, Chairman of the Board of Health, Chair of the School Committee, Superintendent Clenchey, Katrina, Jim Gareffi, Chief Bernard, Chief Clancy, and this past Monday was our first meeting. And we had some good dialogue, and we got to share some of the information that you got here tonight. The working group came to our conclusion that, we think right now that the course of action that we should take would be to recommend is to follow the CDC guideline and consider not just look at Littleton as Littleton's numbers, but Middlesex County. And follow the guidelines that CDC has. So that's what the working group came up with, and certainly there's members that are here if they want to comment on that. But other than that, tonight you really couldn't take action because it wasn't posted that way as we discussed. So any real action would have to be at the next meeting. It would have to be posted clearly on what action that you're going to be taking.
Okay, so can you help me with the posting and the what we should be posting at another meeting?
Sure, happy to.
So I think, go ahead, Dan.
So this was posted as a public hearing for COVID and COVID mitigation strategies. I'm not sure why that's not clear enough of whatever this board chooses to do, take action or not. I'm not sure how that's not a clear enough piece of COVID mitigation strategies in a public hearing. Seems pretty clear and certainly seems actionable on behalf of the Board of Health.
Go ahead, Mike.
Yes, Dan, I understand your concern. Thanks to the good offices of Uncle Anthony, I got a short tutorial from town council's office, including an expert in public health law, and also more significantly in open meeting law. So I put the two together, and in view of the fact that of the issue of since I made the assumption perhaps that one of the options would be a mandate alongside a recommend, two of them at least. There may be a third and a fourth and a fifth, I don't know. That it would be a good idea if we were very explicit in our posting of the agenda so that we understood that our public hearing next, hopefully next week, would be about the strategies discussed here tonight, except more formally, and the fact that we would, at that point, as the Board of Health, take a vote and decide what not recommendation, but what the town should be doing going forward. And at the same time, that invitation is extended, I assume, to the select board, which is in the regulations encouraged to join. And I won't get into the argument tonight of whether or not the select board has to or whatever. It's just that for the town of Littleton, I'm hoping we can work together.
When does the select board meet again?
September 7th.
Go ahead, Dan.
September.
I get two things. One, unfortunately, we do not have town council here to provide the board its opinion regarding this. Certainly under 11131 and 122, and certainly under 310 CMR 1105, that this board can act even without theoretically an open meeting violation if we deem it is necessary for the public health. I am not trying to step beyond that, but certainly a meeting was requested for last week that was turned down by the chair regarding this specific issue. We've decided to have a public hearing tonight to discuss this issue. And now town council via Anthony is saying that we cannot take action as deemed appropriate by the Board of Health under our MGL authority. I guess I'm a little bit confused, certainly from a procedural perspective, how we landed here from a chair perspective. And I'm a little bit concerned that it seems this was not posted as a joint meeting with the select board. The select board basically decided to have a joint meeting. They're here in the dais. They're having their say as any other residents would. But certainly I think if we decided to have a joint meeting during a select board meeting and went in and sat at the big table, there would probably be some discussion around if that was the appropriate way of approaching this. I love their input. I definitely think we as a town, all of our boards, all of our committees, all of our departments should be working together to approach this. And that really is my goal as well. I guess I'm concerned that as we're looking at our numbers increasing, we identified these numbers 2 weeks ago, and we could not take action because we were not posted as a public hearing. We requested a special meeting last week. It was turned down. We are now at 17 potential cases being reported tomorrow. And now we're looking at, again, pushing this down the road. And from a public health perspective, an injury prevention perspective, anytime you see a trend and you push it down the road, it doesn't go well. Those layers of cheese, we're just pulling pieces of cheese out of that pile. And we're just making those holes bigger. And it is much easier to prevent the injury than to try to fix it after the fact.
Madam Chair, if I may.
Yes, Anthony.
Madam Chair, through you to Dan. Dan, it was the message that was passed on was asked through my office that this be posted as a joint meeting. So to say that the select board was just here is inaccurate. This was asked to be posted as a joint meeting, for which they did.
By the select board, not the Board of Health.
Select board. It was asked to have a joint meeting with the Board of Health tonight, and that's what was posted. Number two, as far as your authority, nobody's questioning the authority of the Board of Health, but there is another law that you have to follow. It's called the open meeting law, and that's the law that council weighed in on. So like anything else, when the select board has a matter that they vote on, I'm very explicit in the agenda so people know what the action that the board is taking. So therefore, if they'd like to come and comment on it, they can do that. That's what council has opined on this situation.
And Kevin?
I'll be really quick. Just based what's posted on our agenda, I see no reason why we can't adopt the CDC guidelines for the entire town.
Go ahead, Cindy.
What is the date of the CDC guidelines that you're following?
I believe the last one that's posted right now that references Middlesex County being in the red is dated July 27th. I had a slide up, Cindy, at our meeting on Monday. I could send that off.
Yeah, I'm on the CDC website. I'm just trying to look at the guidelines because you're saying that you want to follow the CDC guidelines, correct?
I believe that's what was recommended by the.
Yep. That's what we've always done.
Okay. I'm just trying, because the CDC guidelines that I'm reading on their website are different than what you're recommending. So I'm just trying to figure out which version that we're referring to. For this
It's listed
discussion.
under the, it's the interim public health recommendations for fully vaccinated people, which I think is part of the problem, people finding it. And it's updated as of July 27th.
All right, because I'm looking at one updated August 19th, 2021.
Oh, there's a new one. Which one are you on, Cindy?
I'm on cdc.gov.
Katrina, it's just
Is it for masking or is it for other things?
I just was looking for, I Googled up CDC guidelines 2021.
Katrina, is this the one that I'm sharing right now that we talked about on Monday?
Yes, that is the one we talked about on Monday.
I think there's a more recent version.
I'm not sure it refers to masking.
Yeah, actually it does.
The second paragraph, the second bullet point is specific.
So Cindy, do you mind? What does the top of that page say? Just, I'll look it up. On the one you're
Yeah, I'm
looking
trying to get back on it. Hold on.
at. They do update things frequently.
Yeah, so it was says your guide to masks. It's on cdc.gov. It's dated, it was updated August 13th, 2021.
So this is their guidance about how to choose masks, a better quality and fit mask to be more protective.
An area of high substantially or, okay, I got you.
Yeah, and it's the area of high and substantial or high based on their CDC community transmission metrics.
Yeah.
For the
perfect.
county.
Good. I just was curious. Great, thank you.
Yeah, no, I'm not sure. I have noticed over the last few weeks, they've been updating things that were inconsistent to the most recent one, which we're discussing, the like everyone wear a mask in high or substantial or high transmission areas.
Right,
That is slowly being updated as they find new places where
Right.
it needs to be.
yeah. So just to reference specifically the date of the one that is being followed for this discussion purposes, I think it's just important. So thank
Yes,
you.
definitely.
Madam Chair,
Yes, Mike?
Madam Chair, to Kevin, who suggested that we quote somehow follow the CDC recommendation. In the follow the CDC recommendation on its surface as an interim step may look appealing. However, it doesn't address the fundamental problem. It doesn't. It basically has. It's basically just a recommendation, and I believe the evidence suggests, given past history and the data discussed tonight, that we're looking for something. This is worthy of a discussion at our next meeting, where we take a vote between either a strong recommendation or something wording like that, or a mandate, or some other stratagem. Okay. And the reason that we're delaying here has nothing to do with the merits of the individual arguments. It has to do with the fact, as Anthony pointed out, we should do it properly, so we can't be second guessed. And it gives the opportunity for the select board to have their own internal discussions, as well as a public hearing on the matter, and come to their own determination to join us or not. But the Board of Health should provide leadership. That is our job, as Dan has pointed out, in this community. And if you read the regulations, as well as what the Board of Health is supposed to be doing nationally, this is exactly it. So to me, what I'd like to do is get the date fixed for the meeting next week, and have a proper open meeting with input from all interested parties and stakeholders. And then we make a determination. And the other thing I want to ask is there interest in the Board of Health approaching Town Council office for assistance in putting together a document which captures at least the two major options, at least to start. And I can certainly use as templates from communities that have already adopted masking mandates out indoors that have been
Right.
scrutinized as a start point, not an end point, a start point.
Right, one from Bill Ricka, there's one here. Yeah, Dan, I'm sorry, this is all new to me. So I'm asking for everybody else's advice on how to make public hearings and votes and everything. So I'm asking Anthony and Janet, and so you can chime in too and help me out. So, but yeah, Mike and Kevin, I'm willing and able to meet next Wednesday and have, as you said, more of a discussion with a vote, a possible vote, and public input. So, anything else?
Madam Chair, you do have two hands raised from the public.
Okay. We are running a little bit late because we have public hearings at 7. They're already scheduled. So if you can ask your question with a brief question, no more than 2 minutes. State your name and address before your question or your comment.
Okay, the first person up is Charles, no last name.
Charles,
Go ahead.
state your name and address, please, your full name. Charles?
He's
You're mute.
muted.
Just pass them on.
Okay, that better?
Yes.
Thank you.
Okay. Charles Howe, 564 Newtown Road. I know you brought up the idea of masks being brought back. The thing you got to remember is when we had masks mandatory before, we didn't have the vaccine. Now you have the vaccine. By going back to masks, I've already been vaccinated, so whatever you decide, I'm fine with. I'm just wondering what's going to be reaction from that 6 to 7% that aren't vaccinated. Going to say, well, see, I didn't get vaccinated. I still have to wear a mask, even if I didn't get vaccinated. So why get vaccinated? So I don't know if by doing this, you're going to get that percentage not to bother getting vaccinated.
Okay. All right. Any comments on Charles's comment? Katrina or Mike? No. Okay. All right.
Next up, we have Judy.
Hi, Judy Reed, Pamela Way. Sorry for the ambulance in the background. I am traveling. I'm kind of upset about this discussion about open meeting law and other stuff. I saw this as a resident. I saw this on the agenda as a public hearing, and I would really like to see the Board of Health, especially since it was on the Board of Health. This is your meeting right now that the select board happened to join in on, but the Board of Health to give me some confidence that you guys know what you're doing in a public health problem. Take a stand, make a motion, do something. Tonight, this is a public hearing for you guys. So I'm really frustrated for a year that you have not taken stands in an appropriate time frame and waiting even another week when our numbers, you just said in a 2-week time frame, our numbers tripled. There's a problem with that. Please take a stand. Thank you.
Next up is Erica.
Madam Chair, again, I just want to reiterate that the select board just didn't hijack this meeting, that it was asked by the Board of Health for the select board to be here.
Furthermore, we posted just for the opportunity for all 5 of us to be able to be here, so there would be no perception that there was an open meeting law violation.
Erica, if you could state your name and address.
Erica Podgorny, 6 Fox Lane. I just want to ask the Board of Health to make a move tonight to put in an indoor mask mandate. We've been here before. We see where the numbers are going. Mask mandates are enforceable. We did it a year ago. We can do it again. Kids are heading back to school, and this variant is even more dangerous to them. than it was a year ago when we had so many more mitigation strategies in place. We need to do this. This is the Board of Health's decision. You are the health agents, not the Board of Selectmen. Please make the right decision and put in a mask mandate to protect our community. Thank you.
Go ahead, Chuck.
It's probably better for Anthony to speak to this, but town council's guidance, and Mr. Zeldin can probably speak to this as well, was that it's a much better message coming from both boards, from a leadership perspective, and through you, Madam Chair, to Ms. Reed. We got the opinion of town council, a specialized town council. It wasn't Tom Harrington. It was someone who specializes in these matters. So, and Mike spoke to that quite clearly. So I think that we are taking it very seriously, and it's important for the Board of Health as the health agents to recommend to the select board and help us to make our decision, because we want to make educated decisions as well. So there's no hijacking happening here. There's no arm wrestling. We're trying to gather data to make the best decision for our residents. Thank you.
Thanks. Go ahead, Kevin. You got to unmute, Kevin.
Madam Chair, I'd like to make a motion for the town of Littleton to adopt the CDC guidelines dated July 27th, as discussed and recommended by the new COVID team.
I'd say you're out of order.
I don't believe he's the chair.
Shh, Chuck. Shh.
Okay, tell me why you're laughing, Mike, and give me guidance.
Okay.
Too. What can we?
I'm strictly. Yeah. The difficulty we have here is that the wording of our agenda is open to sufficient numbers of interpretation that anything we do tonight that involves a vote regarding COVID could be undermined on a legal basis, not on the merits of the healthcare justification. As a member of the Board of Health, I don't want to spin wheels unnecessarily. So what I'm hoping, Kevin, is that you'll join me and others here tonight and others here in town to help put together the options that we're going to face next week for such a vote. That's all I'm saying. And by having this in place, it provides those who have beliefs, desires, inclinations, different kinds of data. It is a way to, shall we say, further delay, because we may have to undo what we do tonight in order to get done what we should get done next week. Okay? So I much rather have a direct line to a result as opposed to 2 steps forward, 1 step to the side, and 1 back. I share your frustration and your grief.
I disagree, and I would ask Madam Chair to ask for a second.
Can I just ask Anthony, is this something that we can do, Anthony?
You're always subject to challenge of an open meeting law if it's not properly posted. So if you take the motion and a second and you vote on it, then if on a challenge, it could have to come back and have to be revoted. But, you know, just, I don't know if everybody's truly had the opportunity to review what the CDC guidance is, because I think that we all follow that anyway. So it's kind of endorsing what's already we're doing. And we're really trying to encourage, at least right now, what the federal government's saying is please follow the CDC guidelines. So that in itself is something that's recommended anyways. So I'm happy to share that again if you want to go through those bullets, but it's recommendation that folks, it's recommendation for fully vaccinated people to wear a mask in public indoor settings in areas of substantial or high transmission. Again, the group felt that we should look at Littleton not only just as Littleton, but as Middlesex County, and that would put us in a high transmission area. and then there's a few other bullets, and I won't read them unless you want to bring them up, but this is something that the federal government recommends anyways. And I think clearly endorsing what the federal government's already recommending, I think that that would be okay. I think going beyond that is just may be a challenge of an open meeting law.
Madam Chair, you do have 6 other hands raised. I don't want to interrupt. I'll let you know.
Go ahead, Dan.
But I feel like we're now stuck on a procedural piece that should never have occurred, that we've known this is coming up for multiple weeks now, but now we are where we are. I would point out that under 310 CMR 11.05, whenever an emergency exists in which an interest of protecting the public health or the environment requires the ordinary procedures be dispensed with, the Board of Health or its authorized agent, acting in accordance with the provision of MGL 11130, our ability to basically create regulation, may, without notice or hearing, issue an order reciting the existence of the emergency and requiring that such action be taken as the Board of Health deems necessary to meet the emergency. I do not feel that we need to invoke this 310 CMR 11.05. However, we've been placed in the position of, we've identified an emergency. The state has declared an emergency. We can see a trend that is concerning to every public health professional that we've talked to here in town. I appreciate Anthony trying to make sure this is supportable. I am disappointed that Anthony and the town council was not able to work with the chair over the last number of weeks to assist her in her role as chair to be able to arrive tonight with what the town council and the town administrator would feel is a agenda that would allow us to take action. That being said, we're here now, and that, again, it is within the Board of Health's scope of responsibility and authority to take action if it deems it necessary. And that bypass, certainly we can put this out there today if we choose to, continue the hearing with this passed, to open up to next week, and we can review that with a more clear, agenda item to meet it. However, that is, again, even without a hearing or an open meeting piece, this bypasses that responsibility for open meeting. Certainly, we've had posted public hearing with COVID mitigation on it under 310-1105. I still believe we are within our scope, and I'm disappointed that certainly the town meeting was able to be present for our TIF discussion around IBM on Monday night, that they're not able to be here tonight. If they had such a strong opinion about how this agenda was structured, that they could not be here tonight to help clarify this for us and make sure that we are both following the rules, but also fully invested with our authority.
Madam Chair, if I may respond to that, thank you.
Sure.
Dan, I think anybody that knows me in Littleton knows that if any board, committee, person, citizen asks my help, they get it immediately. So I was not asked to opine on your agenda. I handle the select boards, but I'm happy to help any other board, number one. Number two, I did ask town council if they could be here tonight. Unfortunately, they had another commitment. And number three, as far as emergency, COVID's been going on for 19 months. So that regulation actually wouldn't apply. And council would say the same thing, that tonight's not an emergency any different than the last 18 months that we've been dealing with COVID. So it has to be properly posted in accordance with open meeting law. I'm just trying to keep the town and your board and all boards out of trouble. So that's what I was advised with town council. I just want to make that clear. Thank you.
Thanks, Anthony. Ed, anybody, the people with their hands up,
Yep.
please? Please state your name and address, please.
Hi, Ina Landsman from 27 Lawrence Street. I think the vast majority of us really want an indoor mask mandate in public places. We know Delta is way more transmissible. We know where this is going. It's not going to a good place. The sooner that we do this, the less likely we are to have lockdowns, the less likely we are to force restaurants to close, the less likely we are to have schools closed. I have a 5-year-old child who cannot be vaccinated, and her health is really important to me. This is something that the CDC and all the experts, her pediatrician, everyone who has a scientific background, who's a doctor, who's an epidemiologist, who has studied this, says this is the right thing to do for us. So I'm asking you to do this sooner rather than later. Thank you.
Next we have.
State your name and address, please.
Okay, I think I was unmuted. Rebecca Lewis, 166 Harvard Road. And I also just wanted to bring up a point hasn't been made, particularly with some of these arguments around sort of individual liberties and rights. Some of us, even if we get vaccinated, are not protected. And we have children in our schools who are currently undergoing therapies that make them unprotected, whether or not they get vaccinated. And I think one of the things people really, we live in this small town. We try to pull together when things are tough for families. We contribute to GoFundMe's when things happen to families. Yet we're asking those of us who are vulnerable to this disease, much more so than those of you who are healthy and in an age range where you can get vaccinated, to please take a mitigation step that will help us. I have barely left my house since this started. My children were remote schooled all year. So the idea that there's going to be some economic hit, it doesn't last isn't a very strong argument to me. The people who are vaccinated are going out, they're shopping, they're doing all these things. They are not wearing masks, which means I can't go anywhere. And I'm not the only one. I know there are other vulnerable adults and children in town. And I really do feel it's our board's job to protect those of us who are the most vulnerable. So I am asking you all to think of us rather than those who can make other choices. Thank you.
Go ahead, Cindy.
I have a question. What is the age group that can't be vaccinated?
12 and under.
Under 12.
And Katrina, can someone respond to that? Why is that?
Because the clinical trial data necessary for 16 to 12 is still being gathered, and it is my understanding the package isn't ready yet, and also the data package for, I think Pfizer is nearly complete, and they've made the first submissions to the FDA. However, Moderna's is not just quite there yet. Hopefully the target time, is my understanding, is the fall of this year sometime. And I have no more.
I think that's actually pushed back to the end of this calendar year is when the packages will be submitted.
We can only hope. I mean, this is tough getting the data for kids. It really, really is tough.
Yeah, no, that's enlightening information to me. So thank you for sharing that.
Be more hands, Madam Chair.
Okay. State your name and address, please.
Hi, it's Eileen Wiedegartner on Maplehurst Road. And I just wanted to echo what I'm hearing from Katrina and Kevin and Mike and Dan, and that we should be doing more to ensure the safety of the public. There are a lot of children who can't be vaccinated. As a resident, I can tell you I would not stop shopping at a place because I have to wear a mask. I think it's the least we can do. We don't allow smoking because secondhand smoke affects other people. Going in and breathing can impact other people. And as a resident and as someone in Massachusetts, I'm also watching people I know who've been vaccinated that are getting COVID through breakthrough infections. So I believe it was Katrina at one of the meetings who had put down a formula, and you can't get to below 1. You can't get that reinfection rate below 1 unless you do have the measures. You can vaccinate everyone in town and not get that reinfection rate low enough until we say we're willing to mask up. And that seems like such a small price to pay for the health of our citizenry. Thank you.
Thank you. And if, next caller, if you can, or next person, if you can state your name and address, please.
Hi, Karen Morrison, 11 Spruce Street. I have 2 points. One, I'd like to ask the Board of Health to consider passing a resolution tonight, a mandate. Go ahead and publish your agenda for next week and pass a superseding one next week. If anybody has a problem with this week's resolution, they can, they can go to, they can sue over 7 days worth of improper procedure if they want. But in the meantime, we have a mandate in place. There's one point that I haven't heard anybody bring up yet. And as a mother of 3 children, 2 of whom are too young to vaccinate, I'd like to point out that school starts next week. Our kids are going into classrooms next week. And everyone sitting here who thinks that there's plenty of time to take care of this is mistaken. If we're going to stop the spread and protect our kids, we need to start today. We needed to start last week or the week before, but that's out of everyone's hands. We need to start today. Thanks very much for your consideration. I appreciate it.
Anthony, can you speak to that?
Again, I think Kevin Baker's motion was, correct me if I'm wrong, Kevin, you would just basically to recommend adopting or recommend the CDC guidelines, right? For
to adopt the recommendation.
Yeah. So I think there's nothing wrong with that. And if you wanted to go further and do a mask mandate, then next week, post it as such, and then take that motion next week.
I agree.
Ed, are there anybody else with their hands raised?
2 more, Madam Chair.
All right, if you could state your name and address.
Hi, Wendy Isaacs, 79 Neshoba Road. I'd like to thank Anthony for the vaccine truck coming tomorrow. I think that's exceptional. I'd like the board, and particularly the select board members that are there, to remember that the Swiss cheese model that we've been talking about for the 19 months, most of the pieces are gone. We no longer have capacity requirements. We don't have curfews. We don't have distancing. We don't have cohorting. We don't have vaccine passports. So we're already down a fair amount of Swiss cheese, and we're down to masking and vaccines as pretty much all that's left, in hand hygiene. So there is some urgency here. I also have to respectfully ask for clarification from Chuck and Cindy. I'm hearing a lot of science from the Board of Health, which is admittedly their job, and then I'm hearing a lot of opinions and what ifs from Chuck and Cindy. And respectfully, this is a science decision and a data decision. And if you have science or data that indicates that Littleton will be as safe without masking, I respectfully ask that you put that forward. If not, I have to, again, respectfully ask that you potentially not intervene in a health decision without data or facts to back that up. And that's what I'm hearing is opinions and, frankly, an astonishing lack of information about the vaccine and about pieces that, as people weighing in on a public health issue, should be more aware of. So if there are stats that you're aware of that this board is not, I would ask you to bring them forward. And if not, I would ask you to step out of the way so that the board can do their job and keep this town safe. Thank you.
If I may just respond.
Go ahead, Cindy.
I mean, honestly, I don't think that we're interfering. I thought that this was a joint meeting that we could gather the information from the Board of Health, up-to-date information, hear more about the perspective. I'm quite honestly, I'm feeling very unwelcome. I have to say, I just am like, why are we here? We were invited to be here. It was a joint meeting. I asked a lot of questions tonight, and I got a lot of information that I was not aware of, and I'm very thankful to be able to participate in this meeting and get that information to enlighten myself. about what is really going on. Unaware about the number of children who are not permitted to be vaccinated. I did ask some questions about positivity rates in town. Were they related to the Life Care Center? Were they not? So, you know, I'm voicing my personal opinion, just as far as masking in general. As a vaccinated person, I also am a breast cancer survivor, and I also have multiple sclerosis. So I am certainly a very vulnerable person to contract COVID, just so you are aware of where I'm coming from personally. I have elderly parents who live in Littleton. My in-laws live in Littleton. They are elderly. So to say that me and my family personally aren't impacted by COVID is an understatement, and to feel that I'm not taking this seriously is really disingenuous to insinuate. And so I'm very grateful to be part of this discussion. And so thank you for the information that has come forward. Certainly, we do have a quorum here. I don't think any member of the select board is going to impose any vote tonight. Certainly, it's, you know, the Board of Health has already brought forward that they want to make a decision on this matter. Kevin Baker brought forward a very good recommendation, which I feel would be certainly a good solution for this evening to move this forward and see what we can do for best as our community as a whole. And I was grateful to work with Chair Flanagan on the Mask Up 01460 campaign. I actually designed that flyer and that banner for the town of Littleton. So I appreciate that you allowing the select board to be here tonight and be part of this discussion. I know you have other people with their hands raised through the chair, Lisa. I know that you have 2 public hearings that you are now behind on. So I just thank you for the opportunity to be here. And I know that the select board will be having this discussion in an upcoming meeting as well. Thank you.
Yeah, Cindy and Chuck, I don't think that this is a discussion that we can have without you guys, without the select board. So go ahead, Chuck.
Thanks, Lisa. And I can't say it much better than Cindy said it. And I think we all have mitigating circumstances in each of our families. And I'm not going to get into my personal situation, but when I was talking about liberties and things like that, I choose to do something a little more than a few extra layers of Swiss cheese, I guess, for myself and for my family. And that's the choice that I make. But as far as any member of the select board, when we get elected to these positions, I'll respectfully call out the members of the Board of Health as well as the members of the select board. None of us are necessarily trained to be on any one of these boards. And I mean, I feel for Lisa, for anybody that becomes chair, didn't go to school to be a chair of a public board in a municipality. And maybe we need to do a better job of Cindy and I had worked on some training a few years ago to help people that volunteer to be on boards, just so they could understand the open meeting law and ethics and how to participate in any board or commission. And so, aside from Mike from his professional experience and Dan from his professional experience, certainly pulling in people like Katrina at the select board level, and for the town administrator, pulling in resources from the state level and trusting that the state has a number of resources, many more available to them than we have available to us. That's where we make our decisions based on, and we try to do it to the highest and best. We try to do the best for the most, is a term that I use quite a bit. So I'm sorry if people don't feel as though we're taking it seriously. It's a matter that we are. I'm not going to speak for the other members, but I'm taking it very seriously. And the fact that we are here tonight is because we are taking it seriously. My hat's off to Anthony for working with Superintendent Clenchey and Chair Flanagan for putting together the working group, which was kind of how the select board being present at this meeting spawned out of that, so that anything that we do want to do in conjunction. We want to do it together with consensus. So I'm not looking to choose sides or poke holes in anybody's cheese, but I just want to make sure that we're doing the best for the most. And certainly I've heard a number of individual cases where people have more vulnerable people than many other folks do. So to echo what Cindy said and to echo what Anthony said, if Anthony believes that Kevin's motion was in fact acceptable, then I think maybe Kevin should make that motion again, and one of you would need to second it in order to take an action on that motion. And then still post the meeting and have the meeting next week. I'd like for us the select board to be part of that meeting as well, frankly, so that we can show a unified force, so that we do show that we are taking things seriously. I just, I don't like when people throw grenades at any board and say that we're not doing this in the best interest, or in the fact that somebody says respectfully several times in a comment, to use Cindy's word, I believe that was a disingenuous comment, and I don't appreciate it. So we put a lot of time into this job, and we all approach it like a job. And I think that the respect that the position holds with it should be demonstrated to the members that dedicate their time, and that goes for the Board of Health as well as the Planning Board, School Committee, and any other folks that dedicate a lot of time to the betterment of our community.
Two more, Madam Chair.
All right, 2 more phone calls and, okay, or comments. Go ahead, state your name and address, please. 2 minutes, George.
Yeah, this is George Sanders, 672 Great Road. I am very disappointed with this meeting tonight. You post a public hearing. Apparently somebody don't know what a public hearing is, because I've listened to you take a general role in this board as a general meeting here. There's been very little, if any, information in the public input into this board tonight. And it started when you started talking about the public. It was at that time a quarter till. The meeting was from 6 to 7. And it was closer to 7 when you started hearing some input from the public. That is not a public meeting. That is not taking input in. I'm going to file a complaint with the Attorney General, because I think what you've done here tonight, you have failed us as citizens in the town of Littleton that wish to speak to this board about concerns that we have. You have not done a good job tonight, Madam Chair, in terms of this. I've listened at the bickering going back and forth between these boards about authority. Authoritarian. I know that the Board of Health is authoritarian in the towns and city in the Commonwealth of Massachusetts. I have a background, and I know that this virus is almost like a biological element. It gets into the respiratory tracts of a person's body, your eyes being the most sensitive one. The masks help protect you. There's no reason why. The school has already sent a letter out and told us what the kids are going to do in school. This should have been started a long time ago with the direction, because the CDC, there's too many pieces of information coming out of the CDC. The FDA just finally got in it. Others in Washington. The governor, I put it on his back because he said that he was not going to mandate masks. He was going to let the local communities do it. It should have been that all information should have been coming out of the public health department, coming into the Board of Health throughout the 351 cities in town. I don't like what I see here and what I've heard here tonight, because I think that we all want to do the right thing. But the bickering that I see is uncalled for. The Board of Health, you are the authority. No question about that. And I think we need to understand there is a need to be cooperative here and get things done to protect the people in the town of Littleton. And more especially, our loved ones that are in the school system. You have a job to do, and it's not an easy job. And I commend each and every one of you for what you're trying to do. Those that are trying to protect the people in the town of Littleton, I give you praise for that, because that's what you're supposed to be doing. And it should be from a scientific information and based on input that is coming in from the citizens in this town. If you're going to have a public hearing, then you should open it up early on to find out what the public has to give you that you then can take and work with. Not at the tail end of the hour that you've designated for this. To me, you need to do another public hearing, and you need not to make no motions and pass anything, because I am telling you, I am going to file a complaint with the Attorney General's office because you did not hold a public hearing here tonight. You did not follow the agenda. Thank you, Madam Chair.
Okay, thank you. Ed, is there one more phone call?
Last one.
Thank you. State your name and address, please.
Solomon Marini, 149 Hartwell Avenue. I would just say that if the board feels that they don't have the authority, or didn't get things properly done to be able to take the actions they want tonight, that's very disappointing. And that Kevin's motion is sort of the barest minimum of endorsing a recommendation that should go forward. Thank you.
Great. Thank you. So Kevin, can you, did you write it down? Could you repeat your motion? Oh, go ahead, Dan.
Kevin, if you like, I've written down a little something if you'd like me to read it, if you wouldn't mind a friendly reread. All right, motion. The Littleton Board of Health order the following COVID mitigation and control measures under the authority granted by the board by MGL Chapter 111, Section 31 and 122 and 310 CMR 11.05, guided by current CDC recommendations, to go into effect on Wednesday, September 1, 2021. The face coverings that cover the nose and mouth will be worn by all individuals over 2 years of age in all indoor public spaces or private spaces open to the public, including but not limited to retail establishments, restaurants, event spaces, places of worship, municipal buildings, school buildings, and other businesses, regardless of vaccination status of individuals. The residents and employees of multifamily dwellings units are required to wear face coverings in common areas and hallways. Universal face coverings are ordered for all teachers, staff, students, and visitors to schools, regardless of vaccination status. Notwithstanding any provisions in this order pursuant to guidance issued by the CDC, face coverings should not be placed on young children under 2 years of age, anyone who has trouble breathing, anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, or anyone who, due to disability, is unable to wear a mask. This order will remain in place until it is updated or rescinded by the Board of Health. Additionally, food service establishment customers may only remove face coverings while seated. All entry doors of businesses open to the public must be posted in a conspicuous location, a notice advising customers and guests to wear face coverings inside the business. Business staff must supervise and enforce this requirement. If an individual is alone in an office area, no mask is required. This order will be reviewed on or before January 12th, 2022 or sooner if Middlesex County is considered to be at low or moderate infection risk via the CDC COVID Risk Tracker website for 4 consecutive weeks, and the Littleton vaccination rate is equal to or greater than 80% for the total population of Littleton.
I'll second.
Madam Chair, could either Dan or Kevin please clarify, is this a recommendation or a mandate?
Recommendation.
But I asked Dan who read it.
That was an order. Face coverings will be worn.
Thank you.
Go ahead, Anthony, please. I need your guidance.
So that certainly doesn't sound like Kevin's Baker. I think that the motion would be in violation of the open meeting law. And I say that just because I think it's a violation of the open meeting law, not that I disagree with what Dan's saying. I will say, and Mike Zelda was on the phone, we have town council that if the Board of Health wants to do this legally the right way, in conforming with open meeting law, we have counsel that used to be counsel at Department of Public Health, which will be more than happy to work with Dan's language and draft regulations that is clearly understandable and enforceable for the town. So that's a lot that Dan read off. And I really caution the board on taking the vote on this and really just going back to Kevin's original recommendation, motion.
Motion was much better than mine. And I stick with my second, and I think that we have the authority to do it. And I ask the chair to take a roll.
I just caution the board that you might be, you're most likely in violation of the open meeting law.
Okay.
Go ahead, Mike.
Through the Madam Chair, to both Kevin and Dan, I am in total sympathy with your direction. Personally, as a member of this board, I think that we need a mask mandate in this town for all the reasons already discussed. It's not based on, it's based on where we are. I'm trying to avoid doing anything that's avoidable that would delay, obfuscate, and mislead. And I believe that this, if we take this action tonight, there's a very, very high risk, more than, shall we say, 50%, that'll be misunderstood, challenged, and consume vast amounts of time, and basically have to be reversed at our next meeting. And that will take time, even 5 minutes, even 10 minutes. We don't have it. We don't have that kind of time. Both you and Dan are correct. We're running out of time. So are the people who spoke from the audience. They understand very clearly, those who attended tonight, we don't have the luxury of time. So I'm asking, I understand if we do this tonight without basically following very strictly open meeting law.
Mike, I got to stop you. Our agenda says mitigation strategies.
No, I'm sorry. Apparently,
you have to go to bat for the residents.
It's debatable. It's debatable.
It's not. It's clear.
Okay. We obviously have a difference about this. I don't want to continue debating it, but I just want to let you know that you've made, at least for me personally, 4 times harder. But okay.
Just do the right thing. That's all you have to do.
Dan, did you have some?
I have 2 questions. One, a procedural question. When was town council consulted on this, on their agenda?
Like, when did we talk? Was it yesterday?
Yeah, it was.
Yesterday.
Yeah, we were invited by letter, just to recapitulate, Dan, you got the letter as well from our chair. Several weeks. A letter saying if you have any questions regarding policy, et cetera. There's a long list of things related to it.
But regarding this individual item on our agenda that appears to be in the problematic wording on our agenda.
No, it had to do with mitigation. And if you had any questions about policy. So I followed the direction of our chair and got in contact with Anthony, and Anthony in turn made a major effort to get the questions I posed, which were tonight. And I got the information from, as was already repeating, from an attorney trained in and all the rest.
So my question is, this came up at least 24 hours ago that we had additional advisement from town council regarding the language of our agenda. While that would have been less than 48 hours, we certainly
Dan, I did not ask him about the agenda. The information was provided to me about the agenda once the answer to my original questions, which did not cover agenda, it covered in particular, full disclosure, what process could we follow without risk, with reduced risk, to have a mask mandate in the town. It didn't say anything at all about our agenda.
We're doing it, Mike.
Okay, hold on. So we have a motion on the floor. It's been second. I have 2 clarifying questions I'm trying to understand. So from Anthony, it said the town council has read it and said the language of our agenda does not allow us to take action tonight that as proposed. I'm trying to identify what that timeline is of when did someone in the town, because it wasn't the rank and file of the board, or at least the majority of the board, who was involved in that discussion, when was it brought to the chairs or Mike's or Anthony's attention that the language in our agenda was not adequate to allow us to take action that we deemed appropriate?
It was brought up yesterday, Mike, when Mike was posing those questions that he had for town council, that those questions and in conjunction with them viewing the agenda, that they came to that they cautioned that it could be challenged.
So while it was less than 48 hours, we could have in fact updated our agenda with clarifying information.
No.
Still potential.
No, it was yesterday. That yesterday to today wouldn't have been 48 hours.
So, Madam Chair, I am willing to withdraw my motion on the condition that it is now 20 minutes of 8 on Wednesday evening, that we call a special meeting of the Board of Health for 8 p.m. on Friday evening, posted appropriately this evening, or if we need to make it 9 p.m. on Friday, I don't care, but or Saturday morning.
We can't post it. The town clerk's not here, so you can post it for,
Okay.
you gotta at least have her be able to do that. So you can post it for Saturday if you want, but you can't really, Friday there's nobody here to post.
Okay, I am certainly happy to withdraw my motion on the condition that we post a special meeting of the Board of Health for Saturday, the 28th, I believe. Sorry, math, it's late. At 12 noon, with a public hearing, with the language from our town council and their consults for potential, or however the language is. Again, we want to make sure everybody's happy for potential mask mandate, spacing mandate. At this point, I would say we're going to list every possible piece of the Swiss cheese, and hopefully that would meet the town council's recommendation for potential options on the agenda. And what we choose to take action on or not take action on is therefore properly posted, properly public, properly listed in our agenda, and that there is no question. Madam Chair, is that a possibility?
Anthony, is that a possibility?
Yes, we just have to finalize the agenda by noon tomorrow. So whatever it is, Dan, that language that you just said to be in the agenda, we could get that done by noon tomorrow.
We can get town council to review that.
If your motion is to take the mask mandate, yeah, you can do that. I still think that it would be wise of the Board of Health to ask to have town council come to the next meeting and help draft the regulations that you just went through, Dan, or at least have an opportunity to review that and opine on that, especially where she was counsel to the Department of Public Health.
I agree.
Happy to have input.
Cindy, you had your hand up?
I did, thank you, Lisa. I was actually going to propose a joint meeting for Monday night with the Select Board and the Board of Health, for this purpose, just so that we could have a joint meeting and have a discussion sooner rather than later about this, and then to also recommend that the language that Dan dictated be sent to town council for review, just to have them look it over before anything's voted and considered. So that was gonna be my suggestion, but.
Well, now we're going in circles.
Well, that was before, that was just my thought. That was why I had my hand raised. That's the only reason why I'm even.
We're going in
I'm
circles.
just telling you why I had my hand raised. Certainly you guys are going another direction and that's fine, but that's why I have my hand raised. So that's all.
Okay.
Saturday at noon.
Go ahead, Mike.
Just a comment, Dan. The council, the document that you read is a pretty close, shall we say, in fact, it's almost a direct copy in scope about a mandate for masking that already exists. And I hope that you could forward immediately to the appropriate town council member, the member of the town council staff, because they're in a position to give it a very rapid review. And I think Anthony's ready to facilitate that rapid communication tonight.
Yeah, Dan, if you email me tonight, then I'll be happy to shoot that off before I leave tonight.
So I'm happy to share that with you and the rest of the board as well for input, and I'm happy for some wordsmithing prior to our meeting, of course.
my advice is to get the input from that council because it's interesting, and I'm not going to go into it anyway. Yep.
The only thing
Great.
keep in mind, Dan, is that, asking town council to come on a Saturday at noontime might be a challenge. So I couldn't guarantee that, but certainly I'll ask them to be available. But it's the last weekend of the summer, so second to last week. But
Oh, Anthony, ask Alexander and tell her Mike wants her.
tell her Mike wants it. You got it, Mike.
Okay.
And can you be there on Saturday, Anthony?
Sure.
Please. Kevin?
So in the essence of time, I'd just like to reiterate my preliminary motion, which can be adjusted at our Saturday meeting if we so choose, for the Town of Littleton to adopt and implement the CDC's recommended guidelines dated July 27.
Yeah, but in looking at Littleton as a Middlesex County data and not just.
Yes,
Yeah,
exactly.
okay.
High transmission area.
So is that a motion?
Yes.
So do we take a second?
I second.
And I'll do a roll call. Kevin Baker?
But-
Kevin Baker, yes.
Excuse me, I'm confused. Are we what?
I know, I am too.
Sorry, Dan has made,
Dan has made a motion, very, very.
it's very different than what
very
Kevin.
thorough.
Exactly, and we'll get more specific at our next meeting when we're allowed to.
I believe, sorry, just procedurally, I believe I withdrew my motion on the condition of our Saturday meeting. So that motion should be off of the floor. At this point, Kevin is placing a new motion on the floor. It has been seconded by Gino, and it is now either open for discussion as the chair would entertain, or for a vote if there's no discussion.
I think I've done with discussion. So shall we take a roll call? Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni,
Jennifer, only yes.
Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Selden, no.
Lisa Flanagan, yes. So we will, Anthony, you will help me?
Yeah, Dan, if you can shoot me that, my email's ansaldi@littletonma.org. The quicker you can do that, the quicker we can make sure that this is posted properly and get all that information to council.
All right. Moving, thank you, everybody, for the spirited debate and all the information.
Madam Chairman,
Yes.
I'm sorry. Now that I'm crystal clear, because I've been looking at the Lambda variant, I'd like to change my vote to yes on the last thing for the record. Thank you.
So we're unanimous.
Yes.
So what happens now? Does somebody make up signs, or do we're still going to wait until Saturday? Be a little bit more specific.
Yep. Sounds like that's what we're doing.
Probably put a notice out, maybe a copy of the minutes if we can get them.
Yeah, we could post it on to the town's website tomorrow.
Okay.
The actions that were taken tonight.
Thank you very much, everybody. Good discussion. Appreciate everybody's help. So we are 45 minutes late for our public hearing on 550 Newtown Road. Ed, are they still here? Oh, sorry.
Do we need to adjourn the select board meeting? Did we open a select board meeting?
I would entertain a motion to adjourn.
So moved.
Cindy, was that a second? You're muted.
I can't read lips.
It was second. It was second.
Second, yeah.
Roll call, Matthew Nordhaus,
Yes.
Cindy Napoli,
Yes.
Chuck DeCosta, yes. Thank you very much for allowing us to join your meeting, folks.
Thank you.
Thank you.
Bye, Lisa.
Thanks,
Thank
guys.
you. Bye, everybody.
Good night.
All right.
All right. Sorry, Ed, is the public hearing for Newtown Road, are they still here? Marky and Ruben?
The applicant will need to raise their hand so I could let them in. the applicant's in.
All right, Mr. Markey, you have to unmute. Sorry for the delay.
Oh, don't worry about it.
You have your,
What's that?
something you can share with us?
Yeah. So, how do I share my screen? Hold on. We're gonna go here. Okay, so 550 Newtown Road is an existing facility. It's currently being used as a self-storage and office space. The existing system was found to be in failure and is within just about 65 feet of the wetlands, which is located in this area. Can you see that? I'm moving the cursor.
I don't think we can see the whole screen. Can you shrink it a little bit so we can see the whole thing?
Sure.
It's a big area.
Is that better?
Yeah, I guess so.
Okay.
I don't think you really
What-
see any buildings or.
So the building is located
Oh,
here
okay, right.
on the left-hand side. And that's the existing self-storage place. And so we spoke with the owners and what their intents are for the property. And it's to do kind of a combined office space / self-storage space. So we did some design calculations to accommodate for that recalculated flow. We did a lot of testing on the site. The site's actually proposed to be split into 3 parcels, one of which has already been split off, which is to the south of the property. That house is being constructed now. There's another system and house to be installed between the one that's currently being constructed and the existing building. We did find an area for a revised system or a replacement system for the property, which is proposed. If you look at the bottom of the screen, you can see this those trench configurations. The trench configurations require the construction of a retaining wall, which will be within a couple of feet of the new proposed property line. There are existing retaining walls on the property now to accommodate a loading dock, which is why we have to incorporate this retaining wall for them to be able to use a portion of that building. Can you see my cursor moving on the screen?
Yeah.
Okay, so in the back of the building, this is all paved area. And the turning movement for vehicles and trucks as such right now is located right here. There's a retaining wall, which acts as a loading dock for a typical box truck. So the box truck would back into this spot and offload. There are garage doors located here. Vehicles which don't have like a raised floor to them, like a pickup truck or a regular passenger car, currently come around that wall and they back up to this area so that they can offload into the self-storage. So the design of this new system located down here requires the construction of this wall so that these vehicles can still make this this turning movement and back into there so that they can on and offload whatever they are, putting into storage. So per the town regulations, regulation 27C, it requires that no portion of a septic system or the fill for a septic system shall be located within 10 feet of the property line. The proposed system
Excuse me.
will be located within an easement of.
I just have a quick question.
Sure.
I just realized where this was. I need to recuse myself.
Oh, okay. So the proposed system has grading within 10 feet, but it's going to be located within a an easement for that adjacent property. We've notified abutters as required through the regulations. Those went out, I believe, more than 14 days prior to this hearing. And I'd open it up to any questions.
Tim, any comments?
So just to kind of maybe bring people back to speed on this, this was a land division process, and the board allowed one lot to be sold off until the applicant could find a replacement system for the existing building. There's a second lot that Mr. Markey was talking about that's adjacent to this. And so I assume that's the next lot that they'll want to split off. So I don't have an issue with the retaining walls and the grading, fill to the lot line. Looks like they're putting it in an easement. So again, that can all be graded at the same time. So should address the board's concerns about grading onto other lots.
Can somebody explain to me what building in the easement means? Either Jim or Ed? What's the easement mean?
So in this case here, Lisa, the easement would be for a fill to be placed across the lot line on somebody else's property. So that easement would allow them to place that fill for the purpose of that septic system on that lot or across the lot lines.
Okay.
Yeah, the fill, if I could just comment as to that fill. That fill is mutually beneficial for both the system and the proposed driveway for that lot. So the ability to actually excavate into it would be negated because of the requirements of both properties, but it will still be in an easement. So basically, if you dug that out, you wouldn't be able to build the driveway, and you wouldn't be able to build the septic system. So that they both require the fill.
Any questions from the board?
I don't see no problem.
Sorry. I'm sorry. I just went to full screen. I don't know if the hands up first. Mike?
Yeah, just a quick question. Who bears responsibility for the integrity, maintenance, et cetera, of the system in view that a portion thereof is affected by the easement? And I assume that the owner of the easement, whoever made the easement, is aware of that responsibility if there is one?
Yes, very good. Awesome.
Yes, the easement language would be put into the new homeowner's lot, stating that they can't, excavate out material on the other side of their driveway. Excavating material outside of the other side of their driveway would actually damage the integrity of their own driveway. So although it's a moot point and you technically don't need the easement, you do need it because technically the septic system would not meet breakout requirements. If that makes sense.
Yep.
Okay.
That's why I asked the question about is there an owner of the property who's providing the easement? I'll use it.
Yeah, the owner right now is the owner of the property, but when they convey the property, it will be conveyed with an easement with documentation stating that the new owner won't be able to dig on the other side of their driveway.
Okay. Dan, you had a question?
I had a quick question. So that second property, has it already been subdivided, or is it still one lot and you're hoping to subdivide it?
It's only been subdivided into one lot at this point.
So we're looking at, really, you're trying to build a system within 10 feet of a property line that truthfully doesn't exist yet? Is that my understanding?
Yes, exactly. So until the board votes on this hearing tonight, but like, let's say that the board unanimously said, we're not comfortable with this, we don't want you to build this system. We would have cut out a parcel and paid for recording and all those fees for something that could never be built. So tonight's hearing, is the predicator of whether we cut out that other lot.
So really the request for this is really so that you can not build the system, because you can build the system without this waiver of regulation. The request really is so you can build this so that you can subdivide the property. If you did not subdivide the property, would you be able to build the system without requiring a waiver? Or have a variance?
No.
No. Even though I thought you said you owned both properties, so.
Well, the property, I mean, when I say.
It's one property, it's not subdivided yet.
Right.
So it is still one property, so you're trying to build, your waiver, your variance request is for fill within 10 feet of a property line that doesn't exist.
Correct.
So if you did not gain this waiver and you built the system as designed, it would not be within 10 feet and therefore would not require a variance.
Correct.
So the request tonight is really a variance so that you can subdivide the lot eventually.
Correct.
Because if you don't get this, then you can't subdivide the lot.
Exactly.
Okay.
I thought the house had a failed system and they couldn't replace it unless they sold the land. Wasn't that something, Jim? Do you remember the specifics about they couldn't do something until they sold something?
Well, I think what they were asking you for, if my memory serves me, I'd have to go back and look at the minutes, but they were looking for permission to sell the one lot to be able to finance the installation of the septic system for the replacement on this lot here. That was my understanding.
So they're not doing that right now. They're doing this.
Well, so I guess, I think when they came in initially, the proposal, and correct me if I'm wrong, Jonathan, was for 3 lots. And what they were asking for is, and at that point, I pointed out to the board the requirements for land division and upgrading systems and all that. So I think that what they were looking for, they asked the board, can we cut off one lot so that we could, have some cash flow to be able to install the system for the existing parcel, with the idea once that system was in, I think they were looking to cut off another lot. I don't know if I have that correct, Jonathan, but.
Yeah, the intent was always to get 2 building lots and replace the system. And until, so that was always the intent. And the designs that were submitted to you, Jim, included that the first lot, the second lot, and then we deemed that the existing septic system for the existing building was in failure, and we had to come up with a design for that lot also.
So they initially had nothing to do with the septic system for the storage building.
Right. The design of the first 2 lots were under the assumption that there was nothing wrong with the septic system for the existing building. And then once we had designed those lots, we had done a Title V inspection and found that system to be in failure. So now we have to find another area on the site to do soil testing. And given that property and the proximity to wetlands and the existing topography around the rest of the lot, the only place that we can get it to fit is in the area that I have designed, and it requires that wall.
Madam Chair, you do have one hand raised.
Sure. Go ahead. Charles, state your name and address, please.
Charles Howe, 564 Newtown Road. Just to let you know, the other lot already has the house built on it. I have no idea where the septic system is going on that. I came in the other day to figure out where that septic system on the other lot's going, and there was no plans. I know Ed looked for the plans and couldn't find them. As to this system, the one that they're talking about, from what I can look at the plans, it's built for 7 people, if I'm reading the plans right.
Mr. Markey?
Yeah, so the way that you calculate design flow for storage facilities is by employee. And then it's also designed for office space. So in the design calculations, there's a split between how many employees work for the self-storage, and then there's a calculation for the number of square footage of office space that is going to be occupied by the building. So it's a lot more than 7 people.
Right, but when I look at the plans, it looks like the plans are built for 7 people, unless I'm missing something.
You're missing something. It's built for 7 people for the self-storage, and then there is office space that's also designed. So there's 2 uses, so it's more than 7 people.
I'm still confused because
I am too.
Okay.
The,
Let me. I'm bringing something up on my zoom out. Zoom in. Office space. So it's designed for a storage facility. Total system design flow is 996 gallons per day, which is calculated for 75 gallons per day per 1,000 square foot of office space. And for a storage facility, it's 15 gallons per day per employee. So that gives you a grand total of 996 gallons per day. So it's based upon employees and it's based upon square footage.
so it doesn't take to any account then anybody who's coming in to use a storage facility that decides they need to use a bathroom.
Look, it's designed per Title V.
Okay.
I have to design per 310 CMR 15, and that's how you do the calculations for office space and for storage facilities. I don't get to just make up numbers, and I have to do what the
State
environmental code requires us to design for.
My other question is, the easement where you're putting this, I don't know if is that the leach field that's going on the easement or the tank? So does the people at 550, then the ones who are responsible for that, if something would go wrong with that?
Just the dirt is in the easement. So the system components themselves are not within the easement. It's just the fill requirement.
All right, any other comments at all from the board or anybody else, Ed, with their hands up?
No one else in the public.
Does anybody want to make a motion? Dan, you have another comment?
Is it, so that second property is not split? It sounds like there's already a house on that property. Is that what the butter had shared, or is that not accurate?
No, so the intent was always 2 lots plus the existing facility. The first lot was already cut out, and that house is built.
And where is that on the plan that's presented here?
You can't see it because of the scale of the plan, it's further south. If I can,
It's another plot beyond the one we can see the edge of?
yes, yeah,
Okay.
it's further south.
Okay. Is it possible to redraw the line so that an easement is not required? Since this has not actually been split off yet and still have the physical lot?
No, it will always require the easement because the soil testing, the only available area for the soil testing that we were able to get to work for the existing facility and keep the loading dock. And then when you have, other regulations for, lot areas and frontages and stuff like that, it will always require that easement.
I guess if you redrew that non-existent or proposed plot line so that the grading easement was actually within the storage facility's property, and that new subdivided piece of land was with that lot line between the two was moved so that an easement would not be required since the entire system would be within the storage system's property.
Unfortunately, there isn't enough area because of the frontage requirements. So the frontage requirements is dictating where that property line has to be. And then the existing loading dock and where we did the soil testing is also determining where the system has to be. And those two can't, that's the reason why it needs the easement, is because neither one of those can move.
So you're looking for an easement for us for grading rather than a zoning board of appeals variance for a buildable lot.
You wouldn't get ZBA approval for a new lot. It's already a reduced frontage lot. It's already a hammerhead lot.
So are we talking easement or variance?
The variance, we need a variance because the wall is going to be
Lot
within
line,
10
yeah.
feet. Yeah. We don't need a variance for the easement. The easement is just there so that it doesn't get excavated. That's all.
All right. Anybody have any more questions or?
If I may, Madam Chair, just a reminder to Jonathan that a wall over 4 feet in height from the base of the footing requires a building permit also.
Yes.
Thank you.
All right, does anybody want to make a motion? I guess we need some more information.
I make a motion to accept. Give them.
We have a second.
I'll second that.
All right, we'll do a roll call. Kevin Baker.
He's recused. He recused himself earlier.
Oh, I wasn't told that, but okay.
Yeah, he did. He did.
Okay.
Yeah.
Oh, I didn't hear him. I heard him say something, but okay. Gino Fratelloni,
Yes.
Dan Kane,
And Kane, no.
Mike Zeldin,
Mike Selden, yes.
Lisa Flanagan, yes. So we're all set. Mr. Markey,
Okay. Thank you for your time. I appreciate it.
thanks. And we'll move on to the public hearing for 63 Witchwood Heights. Is that Kirk? Thanks for waiting, Kirk.
No problem.
My fault. My apologies. I'm trying to get him to be a panelist here.
Oh, that's all right. Kirk, did that Dunn kid work for you this summer?
He should be there.
Unmute.
He's muted. Yeah.
Can you hear me?
Yes.
Good evening.
My apologies. I shut you off accidentally.
No, that's okay. been a long night. I get it.
Thanks for hanging out.
Yep.
Timer's going off.
I'm Kirk Fitzpatrick with Civil Solutions, and I'm here for Gertrude McLaughlin for a property at 63 Woodwood Heights. Share the plan here. So basically what we have proposed before you is a proposed upgrade design for the existing 3-bedroom dwelling. Zoom in on the plan view here.
Really appreciate your plans, Kirk. Thank you.
You're welcome. I appreciate that. Thank you. So
Nice.
it's existing 3-bedroom dwelling. Witchwood Heights Road is out in the front here. It's got a driveway that cuts down the left side of the house. Currently, there's a small tank off the left rear corner of the house, and that feeds the leaching area behind the house, which is in fairly close proximity to a wetland that runs across the back of the property. So we conducted 3 test holes. We actually started up here in the left front corner and ran a perk test there, which ran 2 minutes an inch. We weren't sure exactly how the lot lines were all going to work out, so we did 2 additional test holes on the right side of the property. But given how the property lines did work out, it worked best to situate the proposed leach field in the upper left-hand corner, which maximizes the offset to the wetlands and avoids the gas line in the front, the water line in the front, and excavating in the existing driveway. So this test hole was a very fine sand. It had a water table at 6 feet. So what we're proposing to do is come out to a new 1,500-gallon 2-compartment septic tank. That's going to feed a 1,000-gallon pump chamber, and then it's going to pump the liquid up to a system composed of the Presby and Barrow septic. It's going to be 27 feet long by 15 feet wide. Zoom in a little bit more on that. So this system, the Presby, is going to be a sloping system, so it runs with the grade of the land. So there's no, if the board approves the reduction in the groundwater offset from 5 feet to 3 feet, there's no fill associated with the new system. It will work with the existing grades. That's why we're requesting the offset reduction from 5 feet to 3 feet with the use of the Presby and Barrow septic. And I'd be happy to answer any questions the board might have.
I have a question. Is that a tree?
Yes, this is a tree in the left-hand corner. That's going to be removed.
Okay.
And these little squiggly lines are little garden areas, so that'll get excavated also. Basically, when they construct the system, they're required to dig out the leach field and 5 feet around it, and also that tree. We generally don't like to leave any trees within 10 feet.
Yeah. And you're not squeezing the leach field in because the tree is there?
No, the tree's definitely going to go.
Okay. All right. Any other questions from the board?
Oh, looks good. 3-bedroom, huh?
Yes, it's existing 3-bedroom. Actually, they had taken out an interior wall, but it has a 3-bedroom permit on record, so it's an existing 3-bedroom.
What does Jim have to say about this?
Oh, yeah, I'm sorry, Jim.
So as Kurt mentioned, a couple of things. One, you can see the 50-foot wetlands buffer kind of touches the backside of the house. So you really can't put much in the way down there. That's why that other testing wasn't going to work out. Plus the lot lines kind of made an issue down there. So that system fits up there nice in the corner. The water table is a little deeper. We're able to actually, with this design, get a system that's in the ground that doesn't require fill, but provides a far better system than what was down behind the house. And with the Presby system, if you're to believe all of Mr. Presby's information, the Presby system does provide some treatment. So.
All right. Anybody have any comments or questions for Jim or for Kirk?
No. Which would,
Kevin, Dan, Mike?
Nope. Madam Chair, I'd like to make a motion to approve.
I second.
Okay, so we'll do a roll call. Kevin Baker?
Baker, yes.
Dan Kane?
And Kane, yes.
Dino Fratelloni? Oh,
Dino.
sorry, out of order. Sorry. Mike Zeldin?
Mike Zeldin, yes.
Good. And Lisa Flanagan, yes. All right. Thanks, Kirk.
Great, thank you. Have a good
Did
night.
you hear me? Did you hear me, Kurt? Did Mark work for you this summer?
Yeah, no, he's still with us. I think
Tell
he's
him I
looking
said
for
hi.
some. I will. Thank you.
Did he graduate?
He did graduate. I think he's looking for something a little bit more permanent.
Oh, okay. All right. All
But
right. thank you.
we certainly like having him around. He's great to work with.
He's a good kid. My son went to daycare with him.
He's an excellent kid.
All right.
Thanks.
Thank you.
Have a good night.
Good night. Does anybody want to continue with the discussion about the job description review, or have we? Go ahead, Mike.
Yeah, I'll just make this really quick. I was the one who asked to have this on the agenda some time ago. I'd like to ask, in no particular order, Gino, Kevin, and Dan for their participation. I circulated, I think, to all of you a draft of a particular, shall we say, director of public health, and I would like you not just to take a look at that, but also to prepare a draft, rough in each case, of your notion of what you'd like to see and in what sequence. And the reason I'm bringing this up is because, as you know, we plan on going. One option is to plan to go through a period of transition. So it is conceivable that the first thing that we might do, if it's agreeable at some future point by this board, is to propose having someone, first of all, establish their credential as a sanitarian and work their way up the hierarchy, the non-existent hierarchy, to director at some future point. There are other models, and I'm sure all of you could come up with even better ones. So I'm asking each of you to just put together maybe 1 or 2 pages of a description of what you have in mind for the, shall we say, what the resume or what the qualification should look like for the first hire. And that's all. I'm just asking for help on this. I don't feel that. I think the three of you have some very good experience and ideas and different perspectives, and I think the board should have the benefit of it. Thank you.
Great. Thanks, Mike.
From a procedural piece, it's really not a discussion. It's really not a back and forth, but simply we share our thoughts or edits or additions or subtractions to Mike as a, I was going to say theoretically, he sent it out and we're sending it back. But I just want to make sure that we are not in violation of any procedural piece of serial communication, open meeting violation, that if this comes down the road at some point as the job description presented by the Board of Health for its employee, I just want to make sure we're clear. So I'm happy to provide feedback to Mike, and thank you for putting this together. Job descriptions are challenging for everybody. Certainly when you want the world and you're trying to start from scratch, because we want someone who can do everything, and right out of the gate with hitting the ground running. You know, certainly with support from Jim and the Shoba, but we want a department of one, and that's a hard thing to ask for. I just want to make sure that we are in alignment with the rules, but I'm of course happy to.
I think as long as you send your edits addressed to Lisa through Janet, they can be. I mean, I can collect them as the clerk. That's my job. I'm the clerk. I get to collect these magnum opus. Okay, so please.
Okay, cool. Just want to make sure. Yeah, I'm obviously happy to help and do everything I can. I just want to make sure we're
all right.
Following the rules.
Okay, and any questions you have, please direct them first to the chair, and the chair will order the clerk to do what's necessary. So don't forget, Gino, Kevin, Dan. I'll just put a four week deadline on it for your first draft, which may be your only draft. Okay, gives you plenty of time to ruminate. Thank you very much.
All right. Thanks, Mike. We go to administrative matters, and we all received a lot of correspondence about maskings in school. I think that the state has already taken care of that concern. Is there any participants that have comments?
There's some attendees, but nobody has raised their hand at this time, Madam Chair.
Okay. Does anybody else have any comments on masking on schools?
Jim, has the state actually voted on that?
I believe today the letter came out. I think I saw it this afternoon from the commissioner.
Oh, I didn't see it yet.
Yep. All right. One of the correspondence that we did have, and Dan mentioned it earlier, was the Long Lake algae results. And I think Alicia said that it was at lower levels, Jim.
Yeah, so I'll give you some background just to have kind of how it happened. So the Friday before, there was a concern that maybe the start of a bloom was happening down at the lake. So I met her down there a couple hours after they noticed it.
Are you leaving?
Okay, it seemed to be dissipating a bit, but what I explained to them is that, given the weather we've had this summer, all that rain and then hot weather, it's kind of a perfect storm for algae bloom. So that let it rest over the weekend and pull a sample the first part of the week so we could see what the counts were, the cell counts for blue-green algae in the pond. And yes, the state generally uses 70,000 cells as a standard to close or make advisories not to swim in the water. I think the levels that we got total cell counts, not even just the blue-green, were 12,000, so well under it, and it's remained clear since then.
Great. Anybody have any questions for Jim about the algae, Long Lake? Good. All right. So we'll move on to member comments. Any comments? Go ahead, Dan.
Sorry, I'm chatty tonight. I apologize. One, I want to thank Lisa. This is a challenging time for everybody. Certainly being a chair of any board, as Chuck said, is hard and challenging, and the learning curve is steep for any of us. And I certainly want to make sure that I know I have strong feelings about where we are and what we can do. But if it came across as directed towards you, I'm sorry. We really are just trying to do the best we can. I know you are as well. And I appreciate that and acknowledge that it is hard for all of us. And we're in the place that we can't actually share resources. So we can't say, hey, when I've been on boards or as chair in the past, part of the process is the chair sets the agenda and then it is approved by the body before you move forward so that we would not be surprised. Because of the way open meeting is structured, we can't have that dialogue ahead of time going, here's our agenda, unless we do it today for 2 weeks from now for a regularly scheduled meeting. So it does place a lot more weight on the chair, and it's hard. And I want to just acknowledge that. I appreciate it. It is a different position than most chairs are in. I'm not sure how under the rules we can help you, but I think I speak for all of us that we will do anything and everything to help you be successful because that makes us all successful. And I just want to acknowledge it's a challenging job, and we hear it. And I apologize if my enthusiasm comes through a little bit too strongly at times. I acknowledge that and apologize, but it really is. I do know how hard it is, and I just want to make sure you're aware. I understand.
This is a whole new world that I am in, Dan. So I appreciate everybody's help and everybody's patience with me. So thank you. Any other comments?
So one other thing is that so for our Saturday meeting, I'm not sure if I heard anything from the select board, if they had any intention of attending either as a joint meeting or as attendees. We want their support. However, certainly I think it did in fact create some challenges tonight where the select board was answering public comment rather than the Board of Health. I think it definitely, the dynamic was more challenging as we're trying to look at the public health piece, since both boards have different perspectives and charges. I'm just not sure how to best for Saturday move forward to make sure that we can be successful as a board, be independent as a board, while also working collaboratively with Neshoba and the select board and the school department and all the rest of our boards. That certainly, as we look at all of them, the school committee has just as much of a reason to sit with us on a meeting as the select board or any place else. But as many of the callers commented, that ultimately public health authority lands with us, and the decision that needs to be made lands with us. The select board can say, "Thank you so much, Board of Health. We completely understand and we appreciate your work, and what you say is what we're going to do because that's your job," or that, "Well, we're going to do what you say because it's your job, but we strongly disagree." That is also their right. I just want to make sure that we are continue to be collaborative but make sure that the board can function independently and be able to do our job without trying to balance the select board discussion with public at the same time as Board of Health is trying to have a discussion. If that's anytime you have joint boards, as we heard, who was chair tonight, that sometimes it was not quite clear who was actually chair. It just creates, again, more challenges than maybe we need to. And for us to be successful, for you to be successful, let the board be the board is kind of my thought. So I'm not sure how, as chair to chair, you would like to handle that. If you want to handle it all, I'm not sure what their intention is. Certainly that I had no idea they were going to be, this was a joint meeting until they posted a joint meeting piece. The Board of Health never updated our agenda as that it was a joint meeting. So that my example was, as a regularly scheduled Board of Health meeting that was posted as a Board of Health meeting, that it seemed odd that suddenly they were sitting on the panel without the Board of Health posting it as a joint meeting, or what our procedure was, or what the agenda was for them to be here as part of it. Certainly they need to meet their open to meeting laws. If they're all in the audience at the same time, they have a quorum, they need to meet that piece. But if that was their rationale for the joint meeting, simply to allow them all to be present, that's different than sitting on the board as board members. And just figure out how, as board to board across all of our boards, how do we make sure that we keep that balance of roles, responsibilities, so that we can all be successful.
Hey, Dan, if you want collaboration from the selectmen, you should have a meeting not on Saturday, maybe Monday or Wednesday. Or, you know what I mean? That's the only way you can get a collaboration from the selectmen. You're gonna have on Saturday, a lot of people will not be able to be with the collaboration with the meeting. That's the problem.
Mike?
Sorry to keep you guys longer. I really appreciate Dan's expression. Just to give a slightly different take, I never got the impression that anyone on the select board succeeded in replacing Lisa. Okay. And it's just, in fact, I would have to say that in spite of all the sound and the fury, I think we not only kept to our course, but I think we came out pretty well in what we want to do. I think that I want to thank my colleagues here for promoting and making sure that we met immediately again. You caught the spirit, at least, of where I was heading. What I wanted to make sure, and we succeeded, and I want to thank you for that, is that I'm not sure the select board is prepared to stand in our way, because it was loud and clear we were trying to engage with them and provide, I think, some solid data, a lot of which, unfortunately, they don't do their homework on this because they're not the Board of Health. And I think, very frankly, they don't have Dan, they don't have Kevin with years of experience, and Gino and Katerina waging in, and every once in a while, a little molecular biology thrown in. They don't have that, and they know it. And we're just lucky to have all of you here, and I appreciate it. So I hope on Saturday or whenever we get a chance to do this, we do it right. And it's going to be up to them to either join or not, because as far as I'm concerned, the Rubicon has been crossed and the die has been cast. Let the battle begin. Thank you very much.
No, thank you, everybody. Anybody else with member comments at all? Or Kevin? Okay. Go ahead, Dan.
I know, I told you I'm chatty. I've heard in the past couple meetings from some folks that it is hard when we are in full screen view, one person view, to be able to see the group. If it's possible from LCTV when they're projecting it, if they can do a gallery view, so like the entire board is visible, or the speaker is visible as well as the board during comments, with the exception of probably the full screen for plans and those kind of things where no one would be able to see it in a cube. But for the rest of the time, if this was in person, the audience would be able to see the entire board, during the meeting. If that was possible, that we could keep gallery view up as kind of the default. I'm not sure if that's possible from the LCTV perspective. I know certainly from my computer, I can choose whether I see the speaker view or if I see the gallery view. But maybe if we could just ask LCTV if that's an option, if it's the board's will that we all get to see our faces all the time, and the community gets to see all of our faces all the time during.
Dave, is that something that you guys do, or is that something on
Not a
everybody?
problem. That's something we do, and if it's your desire, I can absolutely do that. Your wish is my command.
Just when we need to see plans, we need to be a little smaller.
Yep.
Kevin, Mike, Gino, any comments? Okay. Ed, any public comments?
No public comments, no hands raised. Just a reminder to Dan to get that email out to Anthony. That was the phone call I got.
Anthony called.
Obviously, I would not be emailing anyone during an open public meeting because that would be inappropriate. And as we learned about open meeting law, having conversations sidelined during an open meeting would be, of course, in gross violation, and that's not something I would do. Which is why, despite having my computer in front of me, I have not sent that email until the meeting is closed.
Perfect.
Anthony called me while I was talking, so I couldn't talk to him. So he should know better. All right. And approve the minutes for, can I get a motion to approve the minutes for August 11th?
Make a motion to approve.
Hold on. There was one typo I noticed. Nothing major. Towards the end of page 2, it's Dane instead of Kane.
So,
but I second that motion with that minor edit.
just when you read them, Dan, I think you just call Janet or email Janet and tell her where the correction needs to be done.
All right, cool.
She'll do that. So, so we've got a second. So, roll call. Kevin Baker to accept the minutes for August 11th, 2021. Kevin Baker.
Kevin Baker, yes.
Gino Fratelloni.
Yes.
Dan Kane.
Dan Kane, yes.
Mike Zeldin.
I wasn't here, so I abstained.
Right, you abstain. And Lisa Flanagan, yes. All right, next meeting, Saturday, noon. And I will talk with Anthony. Dan, you send him the email. I will talk to Anthony and see who's going to be guests, whether it be school, whether no guests. You don't want guests. Town council be it there? Should we, I mean.
Her name is Alexandra.
Alexandra.
Her first name. I think her last name is Rubin.
Okay.
Will we likely hear from her with any edits?
Yeah, that's the one. She's, in fact, that's, yeah, just make sure that nothing stands in your way to get that to her. And if you get, what do you call it? Resistance, let me know. I have another channel.
It's like the Godfather here.
No.
No.
I just make offers no one can refuse. I mean, if it's, I'm teasing. Come on.
I know. All right. So, do we have a motion to adjourn?
Make a motion to adjourn.
Yeah. I'll second it.
Okay. So Kevin Baker.
Baker, yes.
Gino Fratelloni.
Gino, yes.
Dan Kane.
Dan Kane, yes.
Mike Zeldin.
Mike Zeldin, yes.
Lisa Flanagan, yes. All right. Thank you, gentlemen, for your help and your support.